A lot of people ask what interproximal reduction is, or they ask why is it necessary to essentially file between teeth. Here's a case that this is the final positions of the teeth predicted with a software called ClinCheck. This is how the aligners are made. And if you look at the final result, you'll notice that the upper teeth are smushed right up against the lower teeth. There's absolutely no room. And this could be very uncomfortable for a patient. Now, currently, the patient is in a pattern where the teeth look like this. This is a little bit more normal in terms of that spacing if you kind of focus in this area. But currently, those green point ones means the patient has some very small spaces between the teeth. And as you can also see in a moment, the lower teeth, which is the patient's chief complaint, are crowded. And as they become aligned, they move forward. That's how you find the room to make them straight without removing teeth, which was the old fashioned way. So in this plan, the ClinCheck comes back and this is too tight of a contact. And so the way around that, and by the way, the reason why this is like that for this particular patient is because this is a width of the teeth. The upper front teeth are average size, but the next two teeth, called the lateral incisors, happen to be a bit small. And compounding that, the patient has two teeth on the bottom that are supposed to be around 6 millimeters that are 6.6 millimeters. So they're about 10% wider. That's this tooth right over here. It's a very wide lateral incisor. And so we have a choice to create that room. Either we can do a little interproximal reduction. So I'm going to add that here. And if you'll notice, once I'm done with this, virtually you will see that clearance that we would like to have. Not even with that amount do you have that. So you'd have to do even more. Now the alternative, so let's say I even put in 0.4. I'm moving the lower teeth back by doing this. And now we're starting to get a little bit of that clearance. But remember, I told you that the lateral incisors were small. And so the other thing you can do is leave a little space around those teeth. So the patient would have to accept some small space, or at the end of the treatment, get bonding. Now you'll see more of that clearance. That's what you would like. The expression I use to patients, or the phrase I use, is they may have to pick their poison. Nobody wants to finish a treatment with space around these teeth, and nobody wants to have filing done unless it's absolutely necessary. And to be clear, the amount of crowding that this patient starts out with would not necessarily require any room other than what would happen by the teeth moving into a wider arc. But because of the ratio of this patient's teeth, with the lower teeth being a little wider than the normal ratio as compared to the upper, this patient would have an uncomfortable bite. And when you would do something like Smile Direct or an at-home system that did not know how to measure this, then you end up in a situation where you have a patient with a really uncomfortable bite, and you don't want that.